Is an HIV-free generation possible in Zimbabwe? Welcome to the second series on PMTCT on Positive Talk. I'm Tariro Chikumbirige. It is an exciting moment for us on Positive Talk as we launch the second series of the elimination of new HIV infections in children. And we are saying we need to keep mothers and fathers alive. As we launch the series, I'm joined on the program by Dr. Angela Mshavi. Dr. Mshavi is the National Prevention of Mother-to-Child Transmission and Pediatric HIV Care and Treatment Coordinator from the Ministry of Health and Child Welfare. We're also privileged to have Dr. Agnes Mahomba, who is the Country Director for Elizabeth Glaser Pediatric AIDS Foundation. We also have on the program Mr. Raymond Yekeye, who is the Director of Operations from the National AIDS Council. Welcome to the program.
Thank you. Thank you very much, Tariro.
Dr. Mahomba, we are coming back with the second series where we are talking about eliminating new HIV infections in children. Why is this so important, and why is ECPAF seeing the support necessary?
As Elizabeth Glaser Pediatric AIDS Foundation, we work with Ministry of Health and Child Welfare, and one of our aims is to really go along with the national or the country goal of eliminating new HIV infections in children. But I would like to first tell the viewers out there that since we had the first series, as the foundation, we've continued supporting the Ministry of Health and Child Welfare. To date, we are in 1,300 plus health facilities, providing support to the PMTCT program in line with the new WHO guidelines. We are in 60 of the 62 districts. So we are nationwide supporting the ministry. But specifically, since that first series, we have supported the ministry to revise the national curriculum in training for training health workers. We've gone on to provide the first batch of 204 point-of-care machines that do CD4 testing in ANC, so that pregnant women get that service in ANC and they're able to access antiretroviral treatment when they need it. I'm happy to also say since then, we also supported technically and financially the National HIV Conference, whose theme was eliminating new HIV infections in children, keeping mothers alive. So we have had a lot of success working with ministry, with other partners and so on. The success that we're looking at is the actual elimination of new HIV infections. And because it doesn't happen overnight, it doesn't happen after one series of Positive Talk, it doesn't happen after one conference, national conference. It needs us to continue moving forward, supporting the national program, making sure the viewers out there, i.e. the community, is with us. They are actually adopting it as their program. We feel very strongly at the foundation that really we need to keep that passion for that elimination to happen. Elizabeth Glaser herself, who contracted HIV through a blood transfusion in the 80s, that's a long time back, she didn't feel sorry for herself when she found out, and when she actually passed on the infection to her two children, she didn't just sit there. She went out to advocate, to support program implementation, to provide resources or support for research that gives you evidence for this elimination agenda. And she was basically fighting for her two children to get care and treatment. And I'm happy to say, as a foundation here today, as we launch the second series, we continue providing that support to the national program so that that elimination happens. We're not going to sit down. We're driven by Elizabeth's passion and vision of saying, yes, there's a problem, let's do something about it. So this second series, Tariro, is going to help us connect more with the communities, the viewers out there, so that indeed we're not just talking about achievement in terms of numbers we've seen, sites we've supported, but we are really marching on, fighting on for that elimination to become a reality.
So from ECPAF's point of view, is elimination becoming a reality?
First, I want to say it's an ambitious goal that ministry has set for us Zimbabwe, and of course for its partners. We are a partner to the ministry's program, to the national program. We do not do programming as a project for Elizabeth Glaser, not at all. And once the ministry set that goal, we looked at it, we looked at the science out there, the new WHO guidelines that I've talked about, and we actually say, you know what, if we support for them to be implemented nationwide, hence us supporting revision of the training curriculum, providing point of care machines, and so on and so on. It is a reality. It can happen. But I really want to hasten and say, it's not going to happen if we just sort of think it will happen on its own. This is why we're supporting this second series. This is why we are doing it as part of our ongoing support to the national program and not to our own program at all.
Dr. Mshavi, from the Ministry of Health's point of view, has there been progress towards the elimination goal?
Basically, I think as Ministry of Health and Child Welfare, the commitment is there to make sure that in the next few years to 2015, we have a new generation of children that are born HIV negative. In other words, we are committing to reducing the infection rates amongst children. And this would be infection that is passed on from the mother during the time she's pregnant, or during the time she's going to deliver, or indeed during the time that she is breastfeeding her infant. And like what Dr. Mahomba was saying, when we are implementing the prevention of mother-to-child transmission, we committed ourselves as a country that we don't want to continue using old ways of doing things. We were very quick and agile to adopt the revised WHO 2010 guidelines that are pushing us to do a lot more towards elimination. And in fact, you'll find that from last year, we've noticed amongst the facilities that are providing services for pregnant women and women who are going to deliver, a lot of them have now moved on to implementing the much more efficacious regimen for PMTCT. And just as a recap, when a woman tests HIV positive, we are saying we need them to come to the clinic as soon as they know that they are pregnant. And when they visit our facilities, then we offer them testing. And if they are HIV positive, then we can implement or use zidovudine, which is an antiretroviral, from 14 weeks of pregnancy. And I think the whole point of having a talk like this is to communicate this information to our viewers. It's very important that a woman who falls pregnant presents themselves to the clinic in the first 3 months of pregnancy. That means we need to communicate that information, and people then need to present themselves early to the antenatal clinic so that they can benefit from this more efficacious regimen for PMTCT. So looking at how we have moved on from 2011, we've seen dramatic increases in the number of facilities that are doing the more efficacious regimen, as I have just mentioned. And people are really excited that up to 2015, it is possible for Zimbabwe to have an HIV-free generation of children who are newly born, who are going to be born HIV negative. And I think the last time we have mentioned again that that doesn't mean for those children who are already HIV infected, the Ministry of Health and Child Welfare does not have a plan for them. Those children can indeed access lifelong treatment, and they can live quality and healthy lives. And they can be like any other child. So we've seen tremendous progress marching towards the goal of eliminating new HIV infections in children. Importantly, I think a point that you brought up is the conference theme that was for our last year, 2011 HIV/AIDS conference, was really preventing or eliminating new HIV infections in children and keeping their mothers alive. Now, we believe if a mother is HIV positive, we need to check her CD4 count very early on in pregnancy. And if she needs lifelong treatment for her own health, when the CD4 count is less than 350, she must be put on lifelong treatment. And that will ensure that the mother is alive to look after the child when that child is born. And that then offers a survival advantage for the child. You know, that's not to say when fathers are alive, children will die, no. But when a mother is alive, you can almost guarantee also that she's there to look after the baby and nurture the baby through childhood into adolescence and adulthood.
Dr. Mahomba, how then are you supporting children who are born HIV positive? Because our theme is talking about eliminating new infections in children. For those who are born positive, how is ECPAF supporting?
Elizabeth Glazer, Pediatric AIDS Foundation. Our name actually even says it, Pediatric AIDS Foundation. We are providing not just the prevention, as I said. It's very important that we support ministry in prevention of mother-to-child transmission, because if the child is born without it, that's fantastic. Then you don't have to put in extra resources to treat them. However, if for some reason that child is born and they happen to be tested and they're found to be HIV positive, we step in again to support ministry. Remember, the prevention of mother-to-child transmission program is guided by 4 prongs. You want to prevent the infection itself to the mother. You want to prevent unintended or unwanted pregnancies. You want to then also prevent the infection from being passed to the mother to the child if the mother is positive. And finally, the 4th prong, you want to provide care and treatment for those who are found to be positive. And here we're talking of that child and the mother, as Dr. Mushawi has pointed out. So our programming, we actually call it supporting a comprehensive PMTCT package, which looks at those 4 prongs. So the 4th prong is taking care of the child, whether they're HIV positive or whether they're HIV negative. I think Dr. Mushawi pointed it out very clearly that if indeed the child is negative or positive, if the mother is not alive, their chances of dying are much higher. So we want to make sure we're taking care of the mother so that they can take care of that HIV positive or negative baby. If the baby is HIV positive, then they are also put on treatment immediately. And ministry again has provided us that good guidance where we're saying, test those babies early, where we're calling early infant diagnosis. Test those HIV exposed babies early. If they are positive, put them on treatment. So part of our support to ministry is actually also mobilizing resources to make sure those babies are born free of HIV. If they are born with HIV, they are treated together with their mothers, and yes, their fathers. I think we cannot leave them out because they are instrumental in giving the mother bus fare to go to the clinic, in coming with the mother, in ensuring that child gets treatment or care. Remember, in our society, pachiwanhu pedu mwana ndewe baba ndokudzinza rawo. So quite clearly, the men have a role. They have to come in, make sure the woman is getting the prevention she needs, the treatment she needs, and finally, their baby is getting the treatment that they need as well, or the care that they need. We don't believe in just doing things for the sake of doing them. You know, zvanzi zvinoshanda. No, where's the evidence? Where's the research that demonstrates that? This is why, again, we also supported ministry when they adopted the WHO 2010 guidelines, because those are guided by global science. All those detailed quality researches that are done globally feed into that. WHO takes them, analyzes them, and give that guidance in terms of new guidelines and so on. So as a foundation, we're very much driven by not only our passion, by the science, by the humanity. I mean, we need to support our families, our babies, and of course, we will definitely have an HIV-free generation.
Mr. Ekeye, in 2011, Zimbabwe hosted the 2nd National HIV Conference. Could you give us some of the key highlights that came from the conference?
As National AIDS Council and as the government of Zimbabwe, we have always believed that our successes in the HIV response have largely been due to the contribution of our partners. And if you look at our conference in 2004, it was also a multi-sectoral effort where we had a number of our partners coming together to support that particular conference. With this particular conference, we of course worked with a number of partners, but our theme was focusing on eliminating mother-to-child transmission. And also the issue around, of course, keeping mothers alive. And one of the biggest partners that is involved in this is, of course, the Elizabeth Glaser Pediatric AIDS Foundation. And we worked with them and a lot of other partners to ensure that the conference becomes a success. The difference, of course, was that in 2004, we were looking just at HIV in terms of all the thematic areas: prevention, treatment, the mitigation, our management and coordination. But we decided for 2011 we needed to zero in on issues around eliminating new infections and focusing on the keeping mothers alive. And with that focus, obviously, the idea was to generate support, to also galvanize our communities to take part in the PMTCT and the elimination agenda. Not just communities, but right from the highest level of government to the lowest level. So we had everyone, the head of state, we had chiefs, we had community groups coming in to be part of that. The main reason being we wanted everyone to be part of the elimination agenda that Zimbabwe has taken on board.
Dr. Mahomva, any other highlights?
Key to this elimination is really participation of everybody. He has highlighted the President Mugabe himself came and officially opened. It was fantastic to hear him talking about HIV affecting his family, affecting his cabinet, and also him actually highlighting the issue that, yes, keeping mothers alive. What about the men? And we say, amen. This is what we need to hear. We need somebody up there to tell our men in the community that this is your fight. It is not a ministry fight. It is not a donor fight. It is your fight. Let's fight together. So that was fantastic. What was also great at that conference is that the whole society participated. We were amazed by the outcome. I tell you, from the chiefs, we had Maichi Samba there with her show. We had, everybody was there. It was a buzz. And it continued. And the reason why I'm saying it was fantastic, it was great, is because, again, it is not a ministry program. If the community is not with us, with the ministry,